let's talk about the open border health crisis. You've seen the reports of rare diseases resurfacing and the fear that an uncontrolled surge is about to break the American healthcare system. It's a massive security risk, right? Today, we are performing an objective audit of the U.S. health filter. We're digging into the data to answer 3 hard questions. First, is the medical screening for new arrivals a rigorous security check or just a bureaucratic rubber stamp? Second, what is the actual percentage of people entering this country with zero health oversight? And finally, if the system is under such strain, who is actually standing in the way of its total collapse?
Just a quick reminder, if you appreciate this in-depth content, please take a moment to like and subscribe. It helps us bring you more. Now on with the video.
Let's start with the elite filter. Most people think an immigration medical is just a quick checkup. In reality, it is a national security screening. By the time an immigrant gets a visa, they have passed a medical gauntlet that most native-born Americans haven't faced in decades. U.S. law mandates that all residency applicants undergo a medical exam to screen for what the government calls Class A conditions. This isn't optional. Every single applicant must pass through 4 strict health filters. They must be free of communicable diseases of significance, prove full vaccination, show no mental or physical disorders linked to harmful behavior, and have no history of drug abuse or addiction without proven remission. Now, we know what some of you are thinking. You're saying, sure, that's for the legal ones, but what about the illegal majority sneaking in? This is where the numbers matter. Contrary to popular belief, the overwhelming majority of immigrants in the United States, nearly 3 out of every 4, are here with full legal status. We're talking about 73% who are naturalized citizens or lawful residents. We actually did a deep dive on this specific topic in our video, Are Most Immigrants Here Illegally?, which we invite you to watch. But let's address the elephant in the room. The people who cross the border unlawfully. Critics call them illegals and claim they're just walking into our neighborhoods with no oversight. But here is the reality. The medical shield is active at every point of entry. The law is very clear. Every single person apprehended at the border and taken into custody must undergo a mandatory medical screening right at the intake desk. They don't just move forward. They are interviewed by agents using a health screening form. If they have a rash, a fever, or a cough, they are isolated or quarantined to protect you and your family.
Did you even know a federal health form for the border existed? Drop a comment if this is the first time you're hearing about it.
What makes this shield truly effective, however, isn't just that it exists. It's how quickly it adapts. For example, the U.S. added the COVID-19 vaccine to the requirements on October 1st, 2021 to safeguard public health. But as the threat evolved, authorities removed this requirement in early 2025. It proves that from the border to the boardroom, the U.S. health filter is always on and always evolving. So, the filter is tight, but a skeptic might still wonder, what happens after they enter? The fear is that once immigrants settle in, they'll inevitably overload our ERs and strain our public health infrastructure, becoming an indirect health risk and a massive burden on the American taxpayer. Science says that idea doesn't make any sense. There is a phenomenon called the healthy immigrant effect. A major report by the UCL Lancet Commission confirms that international migrants have, on average, lower mortality rates and lower rates of chronic diseases than the native-born population. But what about those scary headlines, like the measles outbreaks? One of the most extensively documented cases of disease transmission occurred in Minnesota, where the source was not a newcomer, but a 30-month-old US-born child who caught it while visiting Kenya. In fact, the CDC reported that in the 2025 resurgence, 92% of imported measles cases occurred among U.S. residents who had traveled abroad. If the vast majority of imported cases are coming from U.S. travelers, why is the public finger always pointed at immigrants? Because it's easier to blame a newcomer than to face the real issue. The NIH investigation into the Minnesota outbreak was explicit. The disease didn't spread because of immigrant biology. It spread because that community was a marginalized, under-vaccinated subpopulation targeted by misinformation. The researchers concluded that the real threat isn't the immigrant, it's the lack of medical integration. While we waste time on meaningless debates about importing diseases, we're ignoring the real problem the studies have identified. But this leads to the last skeptic's question. If we actually bring all these people into the system, won't that finally be the thing that floods our hospitals and bankrupts our taxpayers? The answer is found in the one place that never lies: the math. Let's follow the money. Far from being a strain, immigrants are the financial lifesavers of Medicare. In any system, a surplus is what happens when a group contributes more in taxes and fees than they ever take back in services. It's the definition of a net gain. And the data shows that immigrants are the ultimate net gain for American health. Between 2002 and 2009, while U.S.-born citizens actually created a deficit, immigrants generated a staggering $115.2 billion surplus for the Medicare Trust Fund. Even those without full legal status contribute between $2.2 and $3.8 billion more than they withdraw every single year. They are literally subsidizing the health care of other Americans. And it's not just money, it's the hands that heal you. Nearly 20% of all healthcare workers are foreign-born. We are talking about occupations that require years of highly specialized training. Over 1 in 4 physicians and surgeons in this country were born somewhere else. 1 in 5 dentists, foreign-born. 1 in 6 nurses, foreign-born. If you removed immigrants from the U.S. health system today, the hospitals would close. They aren't draining the hospital. They are the ones running the ER and paying the bills. So, does the myth that immigrants spread disease and pose health risks hold up? The verdict: that is completely false. When we look past the fear and into the facts, we see a community that is more screened, more resilient, and more vital to our health than almost any other. As attorney Chris M. Ingram says, immigrants don't spread diseases. They undergo strict health protocols and bring vitality to our medical field, safeguarding public health while embodying America's compassionate strength. In this video series, attorney Chris M. Ingram and his team are debunking false narratives to raise awareness about the positive impact immigrants have always had on making America great. We'd love to read your thoughts in the comments below, so stay tuned for our next video where we take on another immigration myth.